Yes, hello. My name is Charlotte Thysell, and as Sunny said, I've been working as an acoustic consultant since 2005, where I took my degree in PhD in acoustics. And ever since then, I've been very interested in combining different areas of acoustics to find the best solution acoustically. And today I'm going to see how I can apply those knowledge in my work. But first, I think many of you knows some of the historical background, but some of you might not. I think this is quite interesting. A bit more than 2,000 years before Christ, there were these first musical scales and instruments that were studied in China. In 44 before Christ, Julius Caesar announced the first noise ordinance: "No one shall drive a wagon along the streets of Rome or along those streets in the suburbs where there is continuous housing after sunrise or before the 10th hour of the night." So the idea of having some regulations of noise is not new. The term acoustics, was coined by Joseph Sauveur in 1696. And a lot of different research was going on, specifically on sound waves and strings and how they behave. 1877, Baron Rayleigh presented his work, The Theory of Sound, which is where many people consider is the start of the modern acoustics. He looked back at what has been done before and added his own research. The first quantitative study of noise-induced hearing loss was made by Barr in 1886. He studied how the workers in England, their hearing loss. 1898 is often heard among architectural acousticians due to that's when Sabin determines the relationship between reverberation time in a room and its room volume, and it's still used. 1975, Bronshaft shows that the performance of students is adversely affected by environmental noise. And as I said in the beginning, Julius Caesar, with the first noise ordinance, people were aware that it can be very annoying, but during a period of time, a lot of the acoustician research was focused on the physical effects, but on the later town, it has been more and more focused on actually the health and the comfort, the acoustic comfort, which I think is very important. But I'm an acoustic consultant, but there are, of course, a lot of different fields that you can work within the field of acoustics. And in my work, I read a lot of work from various people with various education and backgrounds. And that's why I find acoustics so interesting. In my work, I work with very different buildings, mainly with buildings, but also with planning. And these are some examples on projects that I've been involved with. And I think if you're from Lund, I think you recognize some of them. I'm going to talk a little bit more on the project on top of there, Forum Medicum, which was just been finished. Max 4 to the left, the focus there was mainly on vibration issues. Today's lecture will be more focusing on sound, not at all actually about vibration, but that's also my field of interest. And of course with dwellings, schools, leisure halls, laboratories, offices, hotels. And Sofiero, which is a castle in Helsingborg, I think is so nice. So I'm working on that one too right now. But I'm going to give you some details on that later on. But even though I think acoustics is a very fun field, it's not just because it's fun that I am able to work with it. It's of course because there is a need. So I make a very short, brief summary of some of the points that I think is interest, and especially of interest in my field. When I'm speaking to people and they ask about what I'm doing, a lot of people say, okay, yeah, it's a problem when you get hearing loss, and that's it. But of course, the acoustic field is so much larger than that, even though that is, of course, really a problem. And I'm starting here for the industry, where you can actually get hearing loss because of noise. But that's not only the problem. Of course, if you don't understand the instructions, accidents can happen. You don't get the warning signals, and you get annoyed, and you make errors due to that. But not only it can hurt your ears, it can also give rise to high blood pressure and high cholesterol, and even more stuff. There's also been shown that there is a clear association between the severity of hearing loss and dementia. So I think a lot of elderly people, they don't want to use hearing aids because they think, oh, I'm not that old, and yeah, I can still hear. But there have been many studies showing that if you have a hearing loss, and especially if you have any other risk factor of developing dementia, you have more than 60% more risk of actually develop dementia if you have a hearing loss. And by the use of hearing aids, you can reduce the risk of developing dementia. So you should really take care of your ears, and if you have a hearing loss, you should definitely use hearing aids. And now I present that information on this slide on industry, but high noise for workers are, of course, in many more places, like in preschools, shops, etc. So it's not only in the industry that you have problem with a lot of noise. So in my field, when I come to an industry, we can help with performing the layout to reduce the risk of noise. In healthcare, noise can affect both the patients and the medical workers. Even though WHO have a guideline saying that the noise level shouldn't exceed 35 decibels in rooms where patients are treated, it's been the levels in those rooms are actually a lot higher, like 50 to 65 dBA is often the case. And the level at healthcare has increased during the last 40 years by about 15 decibels. And this can, of course, not only be annoying, it can disrupt the sleep. It can affect the amount of medicine that you need to take. There's also correlation between there's a higher incidence of rehospitalization if you are exposed to noise. And of course, for the medical workers, it also increased the work pressure, at least the perceived work pressure, and the stress, fatigue, and difficulty in communication. So in healthcare, there's a lot to do to decrease the noise levels. Preschool and schools, also a problem with noise, both for the students and on the teachers. And I should say that this is one of the areas that is a focus here from Lund University. Various institutions are working with this. If you are if you are exposed to a lot of noise for the students, there's a clear risk that you decrease the ability to recover and concentrate. You have a lower performance of reading skills and spelling skills. And what can be seen is that children with special education needs suffer the most. So what the figure shows here is they are comparing the spelling scores in a quiet and a noisy area. And the yellow lines are the typical students, and the gray is the SEN students. And in the quiet zone, there's a difference, but when you have noisy surroundings, the SEN students are affected more. And, well, these special education needs, which students are they? Well, actually, they are more or less everyone in the schools of today. Of course, they who have a problem with concentrating, but also if you have had bad nights of sleep, you can also see that those students are more easily affected of noise. For the teachers, the noise gives increased stress, increased heart rate, and voice problems. During most projects in Sweden, I would say an acoustician is involved when you are designing new schools. And focus is a lot of decreasing the noise and increasing the speech intelligibility in a classroom. Open plan offices. It has been discussed for several years and will probably be discussed even further years. And those numbers that I have on this and next slide can differ depending on the study and the layout. But for one study, you could see that they took 25 minutes to return from the original task after you've been interrupted when you're sitting in an open plan office. You can see that there's a significantly correlated to absence due to sickness, stronger correlation for more complex tasks. And you can also see that even moderate levels of noise can cause sleep disturbances, elevated blood pressure, increased level of stress hormones. And you can also see that it actually also affects the performance of the workers. So whenever you think that you could save some money by pushing more and more people in a small space, you actually lose the performance of your workers. On the next slide, I was about to show the results from a study made here in Sweden by Janke and Hallman. It was a study at the Swedish Transport Administration before and after relocation of their offices. They made some cognitive tests where they tested the short-term memory using a serial recall. You have 11 numbers and you should recall the correct numbers. And before the relocation, the employees that was working in shared or open plan offices performed significantly worse than those in cell offices. The number were 14% worse. And then they moved. And after the relocation to the new offices where they use this activity-based workplace, this is an office where you don't have your own seat, your own place. You're moving to different areas of the office depending on your need. That's the idea. And what they could see was that if you perform this test sitting in this so-called active zone, where you are allowed to talk to others, you perform significantly worse compared to when you're sitting in the other zones. When you compare the result in the active zone with the result in a quiet zone, it's still open, but you're told to be there and be quiet. You increase your performance by 16%, and if you move to an individual working room, you increase the result by 22%. So what is really important when you're designing new offices is that you take into account the need for individual working rooms, the need for quiet zones, depending, of course, of what you are doing on that office. But it's really crucial that you have the ability to have quiet zones and individual working rooms to make these kind of offices work. Yeah, dwellings. This is there's of course a lot of studies on dwellings. What I've read before is a lot of studies finding the right descriptor to correlate to what people think about the noise in a dwelling. By the last couple of years, I've seen new studies dealing not only with finding the right descriptor, but also finding how are we affected by noise in the dwellings. Most complaints are on impact sound, and there have been shown that there are some association between the annoyance with neighbor and stress and increased health risks in the cardiovascular systems. But I should say that those kind of studies are quite few compared to, for example, the studies on traffic noise. So there's a need of more research on that top line. Traffic noise has been studied more frequently, and it can be shown that if you are exposed to a lot of traffic noise, you increase fatigue, get headaches, nervousness, sleep disturbances, and you have a high risk of cardiovascular disease, etc., I should say. Yeah. Another point that is also needs more research is what happens, how are we affected by the low frequency noise coming from, for example, from traffic or wind turbines. You can see that there is a correlation with sleep disturbance, headache, and lack of concentration, but there's also need of more research. So in my work, when we are about to build a new house or planning a whole new district for housings, these are the pros in Sweden. And I'm going to talk about what we do as an acoustician. We start with a comprehensive plan, which look at the large picture of a whole area. Then we go to to the detail plan. We're looking more into detail. Then you go to the building permit when you are actually just looking at one house. Construct it, supervision, and then you always, during this process, you set visions, you following it up, new strategies to improve the planning process. So in this comprehensive plan, this is a picture from Malmö, where there are plans to develop the area close to the sea. Nyhamnen, it's called. And they have just released its comprehensive plan for that area. And in this area, there's a lot of noise from traffic noise, from the industries, and the harbor. And the harbor put really a lot of restraint on this area. So during that time, they're looking at which area are suitable for which type of buildings and activities. They look at, are there any national interest or particularly important systems that needs to stay there, we need to deal with? Are there any quiet and undisturbed areas that we need to preserve? They are doing some noise mapping to see what noises are there and how can they be affected if we start building new houses. And how can we plan the traffic network analysis, the traffic network, to make it sufficiently good. And in this process, as an acousticians, we're involved in all these different areas, making calculations and helping the planners to find the best possible solution. But of course, this is also collaboration with all other demands and criteria that society puts on this area. In the next phase, we go to the detailed development plan. That is when we divide this larger plan into several smaller detailed development plans. And there we do newer and more precise calculations on which levels we have at different areas, coming from the traffic noise and airborne noise and from railway. But we also do calculations on any industrial noise, wind turbines, leisure halls, restaurants, etc., to get a better picture of how this area can be used. Next phase. In this phase, you have a detailed plan. Now you want to build a house, and you need a building permit to start building the house. And in that phase, the focus is on the environmental noise, also noise from the streets and railway, aircraft, and industries. And we do the calculations even more precise. This is a building. Here you have the roads, and those all dots represent levels at different points. We look at the planning, the plan of the house, and make sure that those restrictions that are set in the detailed plan is fulfilled. And in Sweden, if the level of traffic noise is too high compared with what is the legislation says, you want to make the apartment. You make sure that the apartments have a more silent side, and we do this calculation to make sure that all the requirements are met. And in the next phase, before they are allowed to actually build the house, you need to have a starting clearance. And this is where we, as an acoustician, actually design the house, design how thick the walls and the slabs are, make sure that noise from installations will fulfill the criteria. If you're working in a public environment, there are some restrictions on the accessibility that puts demand on the reverberation time of the room. And more or less, we are making some kind of documentation of noise that is given into the authorities. And when we're doing that design, we rely a lot on those criteria that are given by different authorities in Sweden. We have the Arbetsmiljöverket, sets demand on the working environment. Boverket, who sets demand within the house, how much noise, not how much noise, but how good insulation is needed between two apartments, for example. How much noise is allowed from building services? How much noise is allowed within the house from traffic? Folkhälsomyndigheten is a supervisory authority. So whenever someone complains on the noise in a house, they put the restrictions on how much noise that actually are allowed. Naturvårdsverket, the Swedish Environmental Protection Agency, sets criteria on the outside of the buildings and how much noise are allowed from industries in close to dwellings or schools. for example. And the last about 10 years, working with acoustics, the demands from various certification systems actually, we need to take care of those demands that they create to get a sustainable built environment, because they also include the acoustic of the buildings, and you need to fulfill a certain level to get a credit or a stamp. So when you're dealing with the acoustic design of the buildings, you have those regulations, and we work with the exterior noise, the airborne noise, impact noise, that is when someone is walking above or beside your apartment. You're dealing with the room acoustics and equipment noise. You're also making sure that during the process of the building, the construction noise must be taken care of. And I think, to be honest, in many projects, those limits that the authority sets, they're quite often what do you say? They are too high in practice. But serious builders trying to find the best way of, for example, tear a building down without disturbing the neighbors too much. And before the building is finished, we do we make some measurements of the performance of the building. So we measure, for example, the sound level difference, the impact sound, the noise level from services, traffic noise and reverberation. And as an acoustics consultant, we are also involved whenever there is some complaints. For example, complaints on my neighbor, they have recently changed the flooring of their kitchen, and now I can hear them very clearly when they're walking in the kitchen. And then we go there, we do some measurements, and tell them what to do to actually fix it, for example. Or a very common complaint is where you have like a restaurant or a music hall, and you have neighbors on top of that. It's quite often you have complaints on that. The last 10 years, the complaints on gyms, the noise from gyms into dwellings are also increased. But I thought I should speak a little bit more on how I worked in a specific product, and that is Forum Medicum in Lund, which I think, those of you who are here in the room know which building it is. It's just close to where we are now. It was finished this summer. I started working on it about 5 years ago. It's a building where you have education, and you have researchers, offices, you have a restaurant, and the idea is to find and make it easier to collaborate with the researchers and students within this building. So it's very open, a lot of daylight, transparent, and in an acoustic way, you might think that this is a terrible place because seems like there's a lot of glass partitions, a lot of concrete. I don't know if any of you have been there in this building. You've been there? Now you have to say it's good. Okay. This is for an acoustician. This was really interesting task. This building. You have this atrium where students are gathering, having some meetings. You have a library within this open area as well. You have a restaurant to the left and the bottom. It's open to some various student places. So if you're not given it correct considerations, you will have for sure a lot of noise coming from the lower floor to the other floors. You have active learning class rooms, which are huge. They are very big, and still planned to make it easy to communicate with each other, not being disturbed of what the other students doing in the classroom. What I did when I started my work, actually, it had been some work had been done already when I started, but we revised what had been done, and I had meetings with those who are tended to use the rooms, and ask them, what are you going to use the rooms for? What occasions? Does it need to be flexible? What kind of audio equipment are you going to use? In which areas is it critical for you not to be disturbed of what is going on in the next room? Are there any rooms that you actually need some confidentiality? Various questions that was asked and written down. And then I had a look at the floor plan to make sure that you haven't put a noisy room next to a room where you have really need for silent. So then you switch the location of different rooms to make sure it's optimized for sound. And then you also need to be aware of other criteria that are affecting the acoustic design. For example, the accessibility, which sets demands on, for example, the doors and the I don't know the English word, the thing you have beneath the door, because make it accessible, you would like just to go in the room without any disturbing on the floor. But for sound, it's absolutely easier to reach the target if you have something that actually don't transport the noise. Sometimes daylight is also a problem, because to reach the daylight criteria, you want to have large glass partitions. But for sound, large glass partitions, they are not as good sound insulators as ordinary wall. And also they reflect sound very much, so you can have some problems with getting a good sound speech intelligibility. So there was a lot of discussions on finding out the best solution based on all those criteria that was put on this building. Within those processes, I always ask if there are any vibration-sensitive equipment. In this project, it wasn't. But otherwise, that also set some demand on the layout and the building. And in the next phase, when you go into the detailed design, the acoustician, you develop and describe how will a separating wall meet the facade or another glass partition, and still without destroying the sound insulation. So you look into details on how can they be built. Another part that was really on focus in this project was this atrium, where there was a lot of worries being that this atrium should not be too loud. The people that was working in the information desk was really worried about not getting and not being able to focus or hearing what the peoples that were visiting them, because they had a terrible place where they were before. So we made 3D calculations of this room and studied where we could put some absorbents and how they should be designed. We studied how the noise is transported from different areas and put doors at some location and change the walls or open areas to closed areas to give a better acoustic design. We studied how the stairs should be built up. Here we have this is concrete, but here we have a wooden stair, and how that would be built up to make sure it doesn't get too noisy or create too much drum sound. And yeah, drum sound was the field that I was working on as a PhD student. So it was a little fun to look at that. And more on the room acoustic design. As I said, this atrium was a lot of focus. We also looked at the restaurant that is close to it. You want to use the restaurant without disturbing what's happening on the next room. At the beginning, the restaurant was connected to the atrium without any separating walls. Now there is a glass wall that separates those two areas. We had discussions, several meetings on how to design these active learning classes, because there was a lot of different criteria that needed to be fulfilled to make them work. And also we studied the meeting rooms, and especially then the acoustic design, the room acoustic design, to make them work. As in every product, we calculated the traffic noise at the facade to make sure that the facade is giving good enough isolation. We checked out the external noise to make sure that everything that comes up from the ventilation system, for example, it doesn't cause disturbances from for the neighbors. We also made some noise measurements before the construction started, because there are buildings next to it, and they can cause disturbances. So we made some measurements to try to plan the work so that the influence of the noise could be decreased. By this one example for Medicum, I hope I have given you a short but a brief view on how you can work with acoustic, being an acoustic consultant. What I always say to new acousticians or people who are considering being an acoustic consultant or being within the field of acoustics, I always encourage them, of course, to stay here, because I think it's such an interesting field. And the best way to improve is to stay curious. The acoustic field is growing. The awareness of its effect is increasing. The people that we are speaking with today are more interested and more aware of that they need to take care to make sure that the acoustics is good, because it does affect the performance and your health and how people thrive at work. The noise levels are still increasing, so we need to be more aware. Research is definitely needed. We need more research on health descriptors, physical and psychological models, and even more stuff. Even more, the lack that I can see as acoustic consultant is, and I understand why, because the combined effects by sound, sound and vibration, but sound and air pollution, etc. There are so many fields that we don't really know the total effect. So combined effects needs more research. There are always coming new materials that we need to be aware of how they perform, and how we using these spaces are changing. I mean, for example, for a classroom, how you use a classroom is definitely something way different now than just 20 years ago. So yeah, we need to stay tuned. Sustainability is also discussed, and it's coming even more. And almost every project that I'm involved, sustainability is discussed. And being an acoustician, yeah, I think most of you are already aware of it, but it's a broad interdisciplinary field. And to improve the acoustic comfort, we need to include many disciplines. We need to spread the knowledge, and I hope we're doing that today, for example. And it's important to be able to talk about acoustics with non-acousticians. Because what I hear when I'm speaking with non-acousticians, they say, okay, acoustics is so hard, I don't get anything. So that is something that we acousticians need to be aware of, how to talk about acoustics in a way that people understand. And, as I said, you will never get bored with acoustics. It's always some new things. So by that I say thank you.